Hi, I'm Dr. Walter from the Monty Mings Callanvale Vets. Welcome to our weekly Q&A sessions where we'll be answering your questions. This week's question is submitted by Jody from Browns Plains, and the question is, how do dogs get heartworms? Thanks for your question, Jody. I guess to answer that question, you kind of have to understand what the lifestyle of heartworm is like. So heartworm is transmitted by mosquitoes, and it happens when mosquito bites onto a dog that's infected, or dog or other sort of animals that's infected with heartworms, and in the blood they will contain microfilaria. Microfilaria basically is the larvae form of heartworms, and what it does is basically it kind of lives in the mouth parts of the mosquitoes, and it's transmitted to other animals when a mosquito obviously bites onto another dog, and basically with that the microfilaria is then embedded into that tissue of that animal, and most oftentimes it is dogs, into that dog, and from that tissue it will slowly crawl its way into the bloodstream of the dog, and from then on it will start to move to the pulmonary blood vessels of the dog, so your blood vessels in the lung area, where they'll mature over sort of 6 months or so, and will start to cause issues. Now the trouble with heartworm is during that period when they're moving from the bite site to the lung area and before they fully mature, oftentimes they don't cause any symptoms, and most dogs don't show any symptoms at all. And the problem happens when the microfilaria reaches maturity, and when it can sort of reproduce and release more microfilaria. So one adult heartworm in the bloodstream of a dog can produce up to 5,000 microfilaria a day, so that's really quite disgusting, obviously, and that's a lot of heartworms within a dog's body. What does it cause? What does it lead to, I suppose? Heartworm within the bloodstream can cause a lot of damage to the intestinal, to the lining of the blood vessels. It can cause a different sort of immune and hypersensitivity reaction in the dog's body. It can cause several different types of scar tissue in the lungs as well. And the trouble is when the heartworms die, they can oftentimes physically obstruct the bloodstream and causing a huge issue with the heart. And obviously if your main vessels are blocked up, then you have potential heart attack at that point as well. Keep in mind, heartworm can affect any dogs, so it doesn't matter the gender, age, breed, lifestyle of the dog, and although saying that male dogs are 4 times more likely to be affected by heartworms than female dogs, how do we know if a dog is positive or if they do have heartworm? Now we normally do a yearly checkup, and we can do a yearly blood test as well, just to see whether they're positive or negative. If they do come back positive, obviously we've got a diagnosis, and if the dog is showing symptoms at home, we do recommend a fluid blood test, a urinalysis, and a full physical examination as well, just to identify the problem for them. I guess a dog that's infected with heartworm, like I said, they can suffer from a bunch of different symptoms, ranging from collapsing, fainting, abdominal distension, exercise intolerance, weight loss, coughing, and I guess respiratory distress in general. Worst case scenario, obviously, even sudden death as well. So the symptoms are very, very vague sometimes, and it'll be easy to miss, but you don't want it to be heartworm, because the treatment is something that's not the most easy for a dog to go through. So all we need to do with the treatment is obviously we need to avoid any potential complications with the treatment. Like I said before, when a heartworm dies, it can cause a major issue as well. So what we need to do with the treatment, the goal of it is to kill off all the adult worms and the microfilaria in the blood, while at the same time managing any sort of potential complications. Any dogs with severe complications would be hospitalized, placed on obviously cage rest, given oxygen, aspirin to prevent any sort of clot formation, and steroids to reduce any sort of chances for an immune disease or immune disorder. It sounds pretty awful, and it is. One of the worst patients I've had in terms of how they were managing with treatment in a hospital situation and at home was a Frenchie that was tested positive for a heartworm test. As you might know, obviously Frenchie, a lot of them are easier to have a breathing issue, and this particular Frenchie, when we're doing a treatment on her, she started developing really major trouble when she's breathing, and it's something that we don't really want any of our patients to go through, and obviously anyone would want the dog to go through as well. So at Monty and Ming's Vets, we recommend that dogs should be placed on a prevention as young as a puppy, so basically at about sort of 6 to 8 sort of weeks of age, and kept on it for life. So, and there's a couple of different reasons for it. Biggest reason obviously in Brisbane is it's a mozzie prone area, and there's no way you can get away from mosquitoes in Brisbane. And with all that rain we've had recently, oftentimes you do expect a big surge in terms of mosquito population for the next coming months. Treatment and prevention is, well, not treatment, prevention is really quite easy. There's a couple of options. We normally recommend going on sort of injections or oral kind of administered prevention. Most of them would cover other types of parasites as well. And to be safe, we actually recommend to be testing your dogs every year, especially if they haven't been on a preventative for a long time. We actually need to test them first to make sure they don't have heartworm before we place them on any prevention, just because they can develop, like I said before, really severe complications if we do treat them unknowingly. There's so much more I will share about this, but this is all I have time for today. So at Monty and Ming's Callanvale Vets, we would love to hear your feedback about our videos, and if you have any questions, please message in the comment section below or through direct message before Tuesday, and we'll do our best to answer your questions. Thanks for joining me today. See you again soon.